Hey friends, welcome back to my YouTube channel, The Zone of Anatomy. Today we are going to discuss superficial muscle of back in detail. As I've already mentioned, then there are 5 superficial muscles of the back which are major. That is trapezius, latissimus dorsi, levator scapulae, rhomboid minor, rhomboid major. And among these 5 muscles, the most important one which we have to focus more is trapezius and latissimus dorsi, which are the large muscles of the back. Moving forward, let's first discuss about the trapezius muscles. As the name suggests, trapezius is somewhat a trapezoid shape, right? So the muscle, trapezius muscle is flat, triangular. Why we call triangular? Because we are seeing only the half portion. That is why we call it triangular. When we talk about trapezoid, it is somewhat trapezoid in shape, and we call it a diamond muscle because it is trapezoid in shape. So in our examination, what the examiner usually asks is mention the muscle which is diamond shape. So the answer will be trapezius muscle. So do not forget the nickname of trapezius, and that is the diamond muscle. Coming to its origin, the origin is simple, that it originates from the external occipital protuberance. Then it has a superior nuchal line. They have a ligamentum nuchae, and then we have this spine of C7, cervical 7, and thoracic 12. So the origin of the trapezius arises from cervical 7 to thoracic 12. In the examination, the most frequently asked question is basically based on this spine of C7 to T12. So just remember that the origin is from spine of C7 to T12. Coming to the bones, as I have already mentioned that whenever we talk about the muscles of the back, the bones which we need to understand is scapula, clavicle, and the vertebra. So the bones which are associated with the trapezius muscles is only scapula and clavicle. Let's see how they are correlated. So since it is a large muscle, as we have already seen the beginning of the lecture, so it has a 3 fibers in that. What 3 fibers? It has superior, middle, and lower. So the superior fibers, as we see in this diagram, it is moving downwards and laterally. We already know the side determination. This is medially and this is laterally, that is away from the midline. So superior fibers is moving downwards and laterally. The middle fibers, see these middle fibers are going and going horizontally, and the lower one is going upwards and laterally. So we see the 3 fibers. Now, when we talk about their insertion, where they are inserted, so just remember only 2 bones we have to talk about, that is scapula and the clavicle. So first, superior fibers go in the clavicle. Where in the clavicle? Lateral 1/3 of the clavicle. How lateral 1/3 of the clavicle? As we already know that the clavicle is divided into 2 parts, medial 2/3 and lateral 1/3. So here we have the clavicle lateral 1/3, and we are talking about the back portion or the posterior portion. So therefore, the we mentioned here posterior border of lateral 1/3 of clavicle. Then coming to the middle fibers inserted into the border of acromion, and acromion is related to our scapula bone. And the last is the lower or the inferior fibers, which just insert into the crest of spine of scapula. So just remember superior fibers, middle fibers, and inferior fibers. And the fibers which is associated with clavicle is only superior fiber, and the fibers which is associated with scapula, it is middle fibers, and the inferior fibers. So easy to understand. Coming to its action, when we talk about the action, we say elevation and retraction. So the upper fibers which comes to the clavicle, inserted to the clavicle, perform our elevation. The lower fiber, the middle fiber, which goes to the acromion process, retract the scapula, and the point which we need to understand, and it is most frequently asked question in the examination, is that overhead abduction of scapula. Now, some people say that the overhead abduction of scapula is done by serratus anterior and it causes the winging of scapula. You all are right. But when we talk about deeply and an examination, they mentioned the two muscles, that is trapezius and the serratus anterior, then we'll mark the trapezius and serratus anterior option because trapezius also causes overhead abduction. What is overhead abduction? When we have to abduct our scapula above 90 degree. Okay, so this comes in MCQ very frequently. So do not forget, and the fibers associated is upper and the lower. Nerve supply is accessory nerve. Which part of accessory nerve? It is spinal part, which is which provide a motor supply. And we have a ventral rami of C3 and C4 carry proprioceptive sensation. But the most important point which we need to learn is nerve supply done by accessory nerves. So accessory nerves, wherever you get, just mark it trapezius. Now, here is a cheat sheet. Basically, this cheat sheet is a points, like the key points which we need to learn on the basis of all the three books like Gray's Anatomy, Vishram Singh, B.D. Chaurasia. So, from all these three books, I found some unique points that might come in the examination and some have already come in the exam. So first is weakening of trapezius. If, as I already say, that the accessory nerve, which is a 11th cranial nerve, is always associated with trapezius. So when the trapezius is weak, it means there is some problem in the accessory nerve. The accessory nerve can be evacuated by testing the function of trapezius muscle. So it is one of the same thing. Accessory nerve is associated with trapezius, and in Gray's Anatomy, it is easily mentioned that the accessory nerve can be evacuated by the testing the function of trapezius muscle. As winging of scapula is done by serratus anterior. Serratus anterior by the damage of long thoracic nerve, and if the trapezius is involved, then the nerve damage is dorsal scapular nerve. Now, there is a confusion in the largest muscle of the back. So just focus on these 3 points. The largest muscle of upper back is trapezius. The largest muscle of the back is Latissimus dorsi, and the longest muscle of the body is sartorius. Okay, sartorius we talk about in our lower extremities, but when we talk about our upper extremity, then the 2 points which we need to understand at the moment is largest muscle of the upper back, means upper half of portion of the back is trapezius and not latissimus dorsi. And when we talk about complete back, then the largest muscle is latissimus dorsi. Coming to the muscles which are located deep to the trapezius is rhomboids. So rhomboids is mentioned in Vishram Singh and BDC, but in Gray's Anatomy, they have also mentioned the levator scapulae. Coming to the powerful elevator of scapula, so it is a trapezius muscle according to the Gray's Anatomy. Then muscle, when we talk about head and neck, so there in the neck we have a triangles, and that triangle, like interior triangle and the posterior triangle of the neck, is divided primarily by the sternocleidomastoid, and the trapezius helps the sternocleidomastoid. So muscles of the posterior triangle. Just remember one point. I'm talking here about the muscle of posterior triangle and not the muscle which divides complete neck. Okay, if I talk about the muscle which divide their complete neck, then the answer will be sternocleidomastoid. And when we talk about the muscles of posterior neck, triangle of the neck, then we mention trapezius plus sternocleidomastoid. Coming to forced respiration, in forced respiration, trapezius is helpful, which is mentioned by the Vishram Singh. It might come in your MCQs. Then the angle of auscultation. We have already discussed the angle of auscultation in previous lectures. So here, the angle of auscultation, the inferior border of the trapezius form superior border of angle of auscultation. It was mentioned by Gray's Anatomy. But according to the BD Chaurasia, it is mentioned that the lateral border of the trapezium form medial border of angle of auscultation. So if we talk generally, we'll go with the answer of Gray's Anatomy as it is universally accepted book. So go with the Gray's Anatomy, give first priority to the Gray's Anatomy and then to the BDC. Coming to the superior angle of the scapula. When we talk about the superior angle of scapula, the muscle which covers is trapezius, as I already mentioned that it is the largest muscle of the upper back. Coming to the development, when we talk about embryology, then the development is mesodermal and it is mentioned clearly in the Vishram Singh, and the trapezius retracts the scapula. We have already seen the previous slide that the trapezius retracts the scapula with the help of which muscle? That is rhomboid muscles. Rhomboids can be major and minor. So we'll mention here just a combination of what that is rhomboid muscle. Okay. So now, as I already say that the trapezius is one of the large muscle. So there might be some structures that lie under it, and the structures which lie under is are almost 10, and it is not easy to memorize all of them at once. So the trick which we can use is Simran order 4 soups, 2 lemonade, 2 raspberries and 2 ice creams. Why I have mentioned like this, or why I have made the trick like this, because there are 4 S, 2 L, 2 R and 2 I. So I think let's make the trick like this. So Simran, for semispinalis capitis, then 4 soups means 4S, that is spinous capitis, supraspinatus, serratus anterior. Okay, then we have 2 laminate, levator scapulae and Latissimus Dorsi, 2 raspberries, that is rhomboids, and 2 ice creams, that is infraspinatus and the inferior belly of omohyoid. Okay, so it is like complete mnemonic which you can use in it. Simran is just a girl who ordered 4 soups. 4 soups means 4S, that is semispinalis capitis, spinous capitis, supraspinatus and serratus posterior superior. Moving forward to another large muscle, that is latissimus dorsi. Latissimus dorsi is a large flat triangular muscle that is seen in this diagram. When we talk about the origin, then it is originate, just see carefully, it is originate in the thoracic spines from the outer lip of iliac crest, then the ribs and the scapula's inferior angle. So the question which might come in exam is the origin of latissimus dorsi. It's from scapula and which angle? Only inferior angle and not the superior angle. When we talk about it insertion, it is inserted into floor of bicipital groove, and where this bicipital groove present, it is present in the humerus. The unique feature about latissimus dorsi, it is the largest muscle of the back, as we have already discussed, and it might come in the MCQ, largest muscle of back and not the upper back. Then its innervation is thoracodorsal nerve, that is C6, C7, C8, and the C6, C7, C8 is might come in the exam as it is very important. Its atrial supply is subscapular artery, and Its action is extension. What is primary movers is its primary activity. Its adduction, that is primary movers, again its primary activity, and the medial rotation of the shoulder. In examination, usually the examiner asks the medial rotator of the shoulder, the lateral rotator of the shoulder. So the medial rotator of the shoulder main is latissimus dorsi, which is, and the depression of the shoulder or shoulder scapula is done by latissimus dorsi. So just remember these 2 points, medial rotator and the depression. Coming to its cheat sheet, according to the Gray's Anatomy, the serratus posterior inferior, it is deep to the latissimus dorsi, and the serratus posterior superior is deep to the rhomboid muscle. So just see here, it is the difference of inferior and superior, and the examiner usually make us confused between these inferior and superior. So for inferior, we have latissimus dorsi, and for superior, we have rhomboid muscles. Coming to the axilla is a part of our upper limb. So when we talk about the axilla, the posterior wall of the axilla is formed by latissimus dorsi. Since we are studying about latissimus dorsi, I have mentioned it over here. Then there is teres major and subscapularis. Examiner usually asks this question in the competitive exam. So just memorize posterior wall of axilla content, that is latissimus dorsi, teres major and subscapularis. And we are studying about teres major, latissimus dorsi. So I have mentioned over here. So it make easy for you all. Coming to the pelvis. Now we say that sometimes the latissimus dorsi help the pelvis to elevate. Why it do such? Because it has the attachment to ilium and sacrum. Ilium is a part of our hip bone and sacrum is a part of our vertebral column. So pelvis is elevated by latissimus dorsi. When we talk about its clinical is mentioned in our Vishram Singh book. You may refer over there also. The muscocutaneous flap of latissimus dorsi is used to reconstruct the breast mastectomy. Latissimus dorsi is also used in the auto transplant. Why? Because it has the ability to generate the oxygen. Therefore, it acts as the cardiac muscle. So the point which we need to remember is that latissimus dorsi acts as the cardiac muscle. So it is help in the auto transplant, and it has a muscocutaneous flap. So it is used in the reconstruction of breast. Coming to the climbing muscles, when we talk about the climbing muscle, so the climbing muscles is latissimus dorsi. But according to the Vishram Singh, the two climbing muscle is latissimus dorsi and the pectoralis major. When we get the MCQ in pair, then we'll use to mark this answer. And when we talk about primary, we mark only latissimus dorsi. Coming to the axilla, as we have already mentioned above, that the latissimus dorsi form posterior wall. I have make a separate point over here. And the fact about latissimus dorsi is that latissimus dorsi is anatomically muscle of the upper limb, basically the extensor, but it migrates for the functional aspect. So it becomes the migratory muscle also. But in the BDC, they mentioned one line, that is latissimus dorsi develops in the extensor compartment of limb. Coming to our another major muscle, the thing I love about this muscle is that we need to learn only few things about levator scapulae and the rhomboids. So just quickly go through these muscles. Where it is a posterior axio-appendicular muscles. The MCQ come here. Why it is known as axio-appendicular muscle? Because it connects the upper limb to the vertebrae, and it is the skeletal muscle of the back. It they might give this in the MCQ. The origin is transverse process of when we talk about the cervicals, when we talk deeply, they have one transverse process. Okay, so the levator scapulae originate from C1 to C5. Okay, C1 to C5, just it is meant or seen very clearly in this diagram. According to Gray's anatomy, the Gray's anatomy mentioned that the transverse processes of C1 to C5, but Vishram Singh say the transverse process of C1 to C4. If in exam it came, just go with the Gray's anatomy content. Then we come to the inner insertion part. Insertion is just the medial border of scapula, and the innervation. Innervation is very simple. Dorsal scapular nerve, C3, C4, and dorsal scapular nerve. Again, there is the change in the content. Gray say dorsal scapular nerve C4, C5, but the Vishram Singh say C5. But we need to mark only Gray's anatomy answer since it is accepted universally. Coming to the muscle which is present inferiorly or below the levator scapulae, it is the rhomboids. When we cut levator scapulae, we find rhomboids. Blood supply is descending scapular artery and its action is elevate scapula. But the point to remember is it elevates scapula with the help of which muscle? Trapezius, and the fibers of trapezius which is associated with it, upper fibers. Coming to the rotation, it provides medial rotation, as I have already said you that in when we talk about scapula, the only thing which we need to understand which muscles do medial rotation and which do the lateral rotation. So just don't forget this. And it also performed the forced respiration as done by the trapezius muscle also. Coming to the rhomboid major, just learn or memorize one trick that rhomboid major is always below rhomboid minor. Rhomboid major is a big brother and rhomboid minor is a small brother. So therefore, the small brother is always superior and the big brother is always inferior. It is just a small trick so that you cannot forget when you label the diagrams. So when we talk about the major, so its origin is the spinous process of T2 to T5. It is very clearly seen in this diagram. Its insertion is the medial border of the scapula. Medial border of the scapula is mentioned over here. Then insertion is done by dorsal scapular nerve C4, C5. C4, C5 is its root value. Just remember. Then its action is retracts. What does retract means? It means adduct and it elevates our scapula. It connects. Now just clearly see it is the connecting bridge between the scapula and the vertebrae. When we talk about its clinical aspect, when the rhomboid major get affected, then it provides instability to the scapula. Why? Because it is basically providing a bridge. It is acting as the bridging between scapula and the vertebrae. As I've already said, rhomboid major is always inferior to the rhomboid minor. So its location is below rhomboid minor and it's performed the forced respiration as we say in trapezius, as we see in levator scapulae, and again in the rhomboid. Coming to our last muscle, that is rhomboid minor. It is something, rhomboid minor is this, it is something, see, it is a cylindrical in shape, right? Then its origin is lower portion of ligamentum nuchae, spinal process of C7 and T1. It is very easy to understand and everything is mentioned in the diagram. So there is no point of confusion over here. Just try to memorize the diagram and all the content you find very easy. It's the best trick you can apply in anatomy to understand it very well. When we talk about the insertion, it is inserted in the medial border of the scapula, just like the rhomboid major. Its innervation is same, the dorsal scapular nerve, just like the major, that is rhomboid major. Its action is retract and elevates, and that is same as rhomboid major. And it also performs the forced respiration, that is also similar to rhomboid major. So the only thing which we need to understand here is it is small and cylindrical shape, and it is above the rhomboid major. Here I have bring one cheat sheet that is based on the antagonist. Okay, so basically what this antagonist means, if one muscle stop working or get damaged, then the function opposes by it is done by which muscle. So when trapezius, the antagonist of trapezius is serratus anterior, latissimus dorsi, and pectoralis major. Just remember, antagonist of trapezius is pectoralis major and not minor. That's why I mentioned only over here. When we talk about latissimus dorsi, it is deltoid and trapezius. When we talk about levator scapulae, it is latissimus dorsi, both the pectoralis, then deltoid and serratus anterior. Just remember, serratus anterior is the universal antagonist of all these 5 major back muscles. So just put serratus anterior, serratus anterior, serratus anterior, serratus anterior. Only the latissimus dorsi, where serratus anterior do not work as the antagonist. Okay. Then here, the examiner may confuse with the antagonist, like pectoralis major is the antagonist of trapezius, and both the pectoralis, that is major and minor, is the antagonist of levator scapulae. So this is your task for today. Do it yourself. Another do it yourself. Just practice these 2 flashcards. You may find it easy to understand the topic. If you like my content, do like, share, comment your views, and yes, you have to subscribe the channel if you want good content. So guys, here's the end of this lecture. I just need to mention one thing over here, that the content which I have put in this video is from basically 3 books, that is Grey's Anatomy, Vishram Singh, and PDC. Like all the points which are common, I have put them also, and all the extra points which is like important, which we may not study during our exam. So just go through this video before your examination. You definitely find it useful. If you like my video, do comment, do give me your reviews, any change you want, anything, just let me know. Thank you, and thanks for your support. Bye.